911 Global Meds Disclaimer. This video and any contents herein are posted on this YouTube channel of 911 Globe Meds for informational and educational purposes only. Please see the detailed video contents disclaimer and the copyright disclaimer in the text section below.
Ask Dr. Dury this week does cover something quite important, and the question is, does pomalidomide work in patients who have failed on thalidomide or Revlimid, the other IMiDs in the same class of drugs? And fortunately, the answer to this question is definitively yes, because the clinical trials that have been used to assess the new IMiD, pomalidomide, the commercial name is Pomalyst, these trials have been conducted in patients who have previously become refractory or have ultimately failed on thalidomide or Revlimid. And so the very good results that we have been seeing presented and recently published in journals like Blood and the JCO have been conducted in patients previously treated and failing on these other IMiDs. And so the answer is definitively yes, that pomalidomide can work in such patients. But there is an important sub-clause to this response, which is that obviously if the IMiDs have been used in the past and never really produced a very good response, even although pomalidomide could well work for such a patient, it may be that the depth of the response or maybe the length of this response would be not quite as good versus a patient who has responded beautifully to thalidomide or Revlimid for many years and ultimately became resistant. Such patients can have further dramatic and long-term benefit with pomalidomide. And so the prior response does give a bit of an indication about the quality of the response that we might see moving forward. But some degree of response could easily be anticipated. In addition, we do know that pomalidomide works well, obviously with dexamethasone, but also in combination with other drugs such as Cytoxan or one of the proteasome inhibitors such as Velcade or carfilzomib. And those combinations allow pomalidomide to be part of a combination that can work more broadly for all patients, really, patients who have been resistant or not responded well to many prior therapies. And so pomalidomide is really an important new drug, one that can work in patients who have high-risk features such as 17p- or translocation 414 on FISH testing. So an important new drug in the relapse and refractory setting, and one which we really expect to produce good responses even earlier in the disease as we see that happening over time. So pomalidomide, an important drug for patients with relapse and refractory disease, even in patients failing with prior IMiD therapy.